at which we know we can best minimize hospitalizations and deaths. That 50 number is also based on a testing threshold that was set early on by the World Health Organization, with the goal that 4 to 5% of a community's population per month should be tested. If we're doing that level of testing, 50 cases a day means that our positivity rate, which we'll talk about a little bit later, is well below 10%, and that's another threshold that is internationally and nationally used. Finally, that 50 cutoff is very close to some other benchmarks in terms of number of cases per population, what we call the case incidence, that a lot of other national guidelines that you see use as thresholds. And if you look to all the way to the right of that slide, you'll see them in color code form. Green is an incidence of 1 case per 100,000 population. So in New Orleans proper, that would be about 4 cases a day. That is a very, very low level of community transmission. That is the level we want to get to, we all want to get to. Yellow is anywhere between 1 and 10 cases per 100,000. That's a level at which there is still transmission, and there do need to be modifications and restrictions, but generally accepted, more things can happen. This is the threshold that a lot of states use right now to quarantine travelers. So the reason why a Louisiana resident, when they go to New York, has to quarantine for 14 days is because as a state, our case level is above this yellow, right? So these are all ways in which different guidelines, different states, cities, communities measure how well a community, a city is suppressing the virus or how out of control it is. For the first time since our phase 2 spike, our average cases in the last day or two are right at or below 50 a day, and that's good news. We've been here before. If you look at the long yellow line there, we were there for 2 months, so we know we could get back there, and now we need to stay there. Next slide. One of our other big milestones, as you know, is testing. Testing capacity in New Orleans remains robust for the moment. As you can see, we're about 1,500 tests a day performed in Orleans Parish. That's about 3 times the recommended World Health Organization threshold that I just mentioned when we first started planning all this, so that's great. We have tested the equivalent of more than 35% of the Orleans Parish population since March. Again, that is a leading figure. We are leading states, cities, and countries in terms of that. So that is a remarkable achievement by our entire community who's made that possible. Right now, our high numbers are in part likely due to the federal drive-through testing for our surge sites that opened earlier this month. But those are set to go away August 29th. We're advocating to keep them open in some form or fashion, but we continue to urge all residents who feel like they have been exposed, have symptoms, or need a test to take advantage of those sites while they're available, or go to any one of our community sites that continue to operate. Again, please go to ready.nola.gov/mobile-testing to find a testing site near you. So you've probably heard percent positivity rate discussed by the governor or other leaders as a way to gauge not only how good testing is in a community, but also the level of virus that is circulating. In many hotspot states and communities in Louisiana, this rate is above 20%. So Florida, multiple parishes, several of the river parishes right now, several of the parishes near Baton Rouge have positivity rates above 20%. That means that 20% of all tests being done come back positive for COVID. Those are indicators of severe outbreaks and inadequate testing, most likely. Our community, as are many around the country, look to this rate, look to a rate of below 5% as one of the measures to help figure out if schools are safe to reopen. I'm happy to report that since the beginning of August, we have been, on average, below 5%. Again, this is a good trend. This is a trend that puts us in a leading position compared to the rest of the state and many of our neighbors, and so we need to keep it up. Hospital capacity continues to be a big concern around the state. You might have heard the governor mention yesterday that 15 ICUs statewide had 0 bed availability. You don't have to be a healthcare professional to realize that's a scary statistic. Though none of them are in the New Orleans region, thankfully, we feel the effects statewide. Our Region 1 hospitals have, for weeks, as I've mentioned, been taking transfers from other parishes and states who do not have capacity to care for everyone that needs it. This pushes us closer to our thresholds for concern, our metrics. So we are not overwhelmed. We do have capacity, but it is external forces that are pushing us closer towards that. And it's not just physical beds. Staffing shortages due to illness, fatigue, and increased demand for staff everywhere mean that there are often not enough nurses, techs, personnel to care for patients in beds. As long as Louisiana remains a hot spot, we are going to feel this in New Orleans. Contact tracing has also been a challenge nationwide, as you've likely heard. We have hundreds of professionals on the job, which is great, statewide, and they're able to reach about 7 in 10 positive cases. Obviously, we want that to be as many as possible. However, of those people that they reach, nearly 3/4 report that they have had 0 contacts since their illness began. Quite honestly, that's impossible, right? 75% of people, it's unlikely that they have interacted with 0 people in the preceding few days. So we again want to urge our residents, please, if you've tested positive for COVID, when the contact tracers call, let them know who you've been in close contact with to protect your contacts, your friends, your neighbors, protect our community from spread. Contact tracers are specially trained in privacy standards, and they are not going to disclose anything personal or get you in trouble. So I want to put our milestones and our data in context with some other places. As you remember, both New York and New Orleans gained notoriety early on for being 2 of the biggest COVID hotspots. While fortunately our healthcare system was never quite to the point where New York's was, like New York City, we were hit very hard, very fast. As you can see, our curves look very similar in those early days. Until about early July, where you can see that New York, who is the orange, stays flat for the last 2 months, while we have seen that post-phase 2 spike. New York has remained so fast that they are one of the few major metropolitan school system that feels comfortable in reopening schools at their timeline. This divergence since July between us and New York is likely due to the fact that New York has taken a somewhat slower, more measured approach to reopening. They have had more restrictions in place throughout the summer, and they did not open multiple sectors as widely as Louisiana. So how do we compare with the rest of the state? This graph is showing our case rate, again, per 100,000, so it's how many cases per population for New Orleans, which is orange, and the rest of the state if you take New Orleans out, then that's the blue. So as you can see, we were fairly similar when everyone was in phase 1, but right after phase 2, there's a fairly big divergence. So if you recall, New Orleans was and is more restrictive, even in phase 2 and currently in our guidelines. Our gathering sizes are smaller. Our mask mandate was earlier than the state, and our residents adopted it very widely early on and took it really seriously. Our limits on other potentially high-risk activities are stronger in Orleans Parish than they are in most of the rest of the state. We know, we've seen that our residents take their personal responsibility to heart and have really, gone with the guidance. This is likely why Orleans Parish, our rate of cases, new cases, continues to be lower than the state. In fact, other than Cameron Parish, Orleans has the lowest case incidence of any parish in Louisiana, and we need to keep it that way. So, where are we now? It's mid-August. Our first and most important priority right now as a community, from both public health and economics, is safely returning kids to school. There's been, unfortunately, no real national standards or guidance on how to do that, or what level of outbreak is appropriate to even have that conversation. But most public health experts agree that suppressing community transmission of COVID is essential for a safe return and a sustainable reopening of schools. You've already seen examples from around the country in the last week or two where schools reopened in places with high levels of viral transmission and have had to shut down within days. Georgia has multiple examples of this that probably you're all aware of. That cycle of open, close, is incredibly detrimental from a health standpoint, from a psychological standpoint, and from a business and economic standpoint. So what do best practices tell us in our community? What guidance are we giving to our school systems? How can we best advise them? Really, again, the level of transmission of a virus in the community is incredibly important for understanding how safe we think it will be to go back to school. I'm going back to the green, yellow, and red with those same thresholds we talked about because there is some guidance from Harvard that matches up with CDC guidance that tells us strategies to consider. As an international comparison, when other countries have opened schools, very few of them have opened with cases above 5 per 100,000. So they are in the yellow or green when they open schools. And the ones that have been successful have been sort of on the lower end of this yellow or green. When we advise all of our school system leaders, public, private, Catholic, at the time of the initial decisions a few weeks ago about school zone opening, New Orleans was squarely in the orange, with cases above 50 per day and a higher positivity rate above 5%. So there was not an indication that reopening would be largely successful. There were a lot of concerns about that. You've heard from NOLA Public Schools, and you'll probably hear it again. I know they've got a press conference this afternoon. The metrics they're tracking with us to determine the best time to implement their reopening roadmap are sustained cases, 14 days plus of cases below 50, adequate testing, positivity rates below 5%. As I've just presented, we are making progress. We are getting there. We need to keep it up. So for us, this is really our shared community focus, doing everything we can on an individual level to keep the recent progress going so that our children, particularly our youngest and most vulnerable, can return to in-person learning. The public health benefits of full-time in-person school are very clear. They've been reiterated by experts around the globe. In speaking to business leaders, having consistently open schools is an absolute necessity to move our economy forward. So this is a goal that unites us all and crosses every sector of our community. There are challenges to this that we are keeping in mind and communicating, with our partners. We don't know the effects of other school systems opening, whether that's the other private Catholic school systems or our universities coming back to campus. If everybody continues to wear masks, social distance, avoid large gatherings, practice good hygiene, hopefully we can mitigate any potential effects, but we do have to be mindful. We also have learned a really hard lesson in phase 2 of what happens when too many restrictions are relaxed at once. The sharp rise in cases and our healthcare system strain is a result of that. So if, as a community, we agree that schools and our children's future is the priority, then reopening schools is the only restriction we should be relaxing for the foreseeable future when we can. We have seen with Katrina what happens when we jeopardize education for thousands of children, and so we cannot deliberately do that again. One more on the vaccines. I want to set a realistic timetable for a vaccine, because there is rightly so a lot of information out there. There are many in development, at least 7 by my count in large, what we call phase 3 trials, so trials on thousands of human subjects. And we know that the federal Operation Warp Speed is trying to put a mechanism in place that would support rapid, large-scale production of any vaccine that's proven to work. The FDA has been very clear, as they should, that nothing will be approved unless it's safe. We are not Russia, and we do not want to rush anything that will be unsafe. If progress is made lightning fast, as we all really hope it will be, most experts, from Dr. Fauci on down, agree that this vaccine would still not be available for the general public this year or likely early next year. There will be a priority set by the federal government as to who would get the first millions of doses of the vaccine, and it would almost certainly be healthcare workers, obviously, and then likely high-risk individuals and others that they're working on. So this is a marathon and not a sprint. We will almost certainly have to maintain our masking, social distancing, gathering limits, hygiene practices for the foreseeable future. Fortunately, in New Orleans, we have the most resilient citizens in the world who have proven again and again, and especially over the last 5 months, that they can succeed in a huge way and truly save the lives of their friends and neighbors. So thank you, New Orleans. Our progress is because of you, and we are all in this together. Thank you. I'm happy to take questions if anybody has any.
Okay, Foxy?
So, obviously, you were saying that, to be successful, the only restrictions we should relax are reopening schools. We're not sure what opening around us could have on our community. What are you thinking? How much data? I know yesterday there was a mention of 2 to 3 weeks of data before any consideration to relaxing other restrictions would take place. Is that what you're looking at right now?
I think it at least has to be that. Again, we have to, if we believe that opening schools may cause more virus circulation, we have to prepare for that. And we have to really sustain any, our low levels. We have to get to those low levels and stay at those low levels. So it would be at least several weeks once kids are back. And remember, when children go back to school, it's not going to be K through 12, everybody open, right? The schools have a very well thought out, careful who gets back into in person every day and who might go later, right? So in my mind, their strategy, really is paramount, and supporting that strategy is important. So we can't make the mistake of doing too much, because then that will jeopardize our children. So it will be at least several weeks, most likely, after children get in school and stay in school.
So likely at least 2 to 3 weeks after Labor Day.
If we return after Labor Day.
Okay. Are you thinking that we may return before Labor Day?
Well, we're all looking at the same data. We've just sort of dipped our toe into that case number that is a good case number that the everyone is comfortable with. That's 2 days. We need a sustained, 2 weeks of that. So it may not be, right? It may not be right after Labor Day, but again, that's using everything that you see here. That's exactly what the schools are using to make that decision.
And just one last question. So the restrictions that were made in place would be everything that we're seeing right now?
Yes.
Everything that's in place right now would stay the way it is?
Yes, as long as we are making progress, yes.
WWL.
Can you talk a little bit more just about some of the challenges with contact tracing? Obviously, you have enough staff to make the phone calls, but you need the cooperation from people. What are those challenges, and why do you think people aren't so forthcoming with anything?
Yeah, I think, and again, this is a nationwide problem. I've looked at LA's numbers, New York's numbers, they're very, very similar. So some of it might be a language barrier. I know that LDH is really trying to make sure they have staff that are trained in other languages, that can really effectively communicate in other languages. Part of it is really, I'm afraid I'm gonna get my friend in trouble. I'm embarrassed. I don't feel bad, so I'm just gonna, assume that everything is okay. or the fear that your personal information might somehow be broadcast. Again, this is why not everyone can be a contact tracer. There's really strict protocols that you have to go through and learn. And just sort of a mistrust, unfortunately, a mistrust of who's calling on the other end of the phone. But, we really urge people, this is to protect your friends, it's to protect whoever they're going out and infecting, because they don't know.
Is there something that you or the state are, working on that may help improve numbers?
Yeah, the state has all sorts of initiatives, and I don't want to speak for them, but I know they're really trying to get at the roots of the problem. They're trying to find innovative pilots that they could have more sort of boots on the ground, so it's not just somebody calling you from a call center, but is there a way to have a more personal touch of somebody in your community who can make maybe a more direct connection. So they're really, really trying.
Yeah.
We've seen reports already where kids have had to quarantine positive cases when in-person school has returned to other parishes. Is there some level of spread that you are expecting when schools do be open for in-person? And what level would you consider intolerable as a reason why we would have to go back to open learning?
Yeah, we just don't know. No one knows. That's why, we are trying to be very clear when we're reporting and publicizing the data, what those green, yellow, orange. Like I said, no other country has successfully reopened outside of the yellow range. And that yellow range correlates pretty nicely with our 50 cases, per day. So that is our estimate. We feel like it's based in as much science as we know at the moment. If our cases suddenly shot up to where they were a couple of weeks ago, then I think that would be a clear indication that the community transmission was too widespread and we would have to go back. And the schools are very aware of this. They built, if you guys, remember, they built in this escape clause, right? So that they could really follow this and know when it was safe to go and safe to pull back. We believe that success is a slow and steady approach to reopening, because going back and forth would just be devastating.
And as a follow-up to that, could you see a scenario in which, similar to where we saw with restaurants and bars, where like one school there was a big surge or uptick in cases, would we have to go back to virtual for the whole system?
Yeah, no, I think that's part of the school's plan. It's part of all the school systems plan. If it just happens to be at one particular school, you would hope to not have to shut down the system for that. However, if it's cases breaking out in multiple different schools, that's a little bit of a different story.
GNO?
There's a lot of information out there and misinformation out there about this virus. Are you comfortable, I guess on the vaccine level, are you comfortable with where the scientific community is on this, getting a grasp, getting a feel, and kind of understanding the attack?
Yeah, I think we've learned so much since March, or since even before March, really. And I think that the companies and the partners that are working on vaccines, the majority of them are very trusted partners. There are a few clinical trials actually happening in New Orleans, so if residents are interested, again, they can go to ready.nola.gov and find out if you'd like to participate. I was really encouraged to see the FDA come out very strongly and say, we will make sure that this is a safe vaccine. We want it to be fast, but if it's fast and no good, then it will set us back. And I think the scientific community is cautiously optimistic.
The issue? Box 8.
Yes. Have we learned anything by what we've been seeing in daycares? Obviously, they were not required to shut down, but schools were. What are we seeing within the daycares, and is that giving us any indication of what we may see when schools reopen?
Yeah, and daycares, for a large part, operated throughout. Certainly with smaller sizes, many of them closed. If you look on the LDH website, they report outbreaks on a regular basis. Daycares do not, seem to be, at least what's being reported to them, a large source of outbreaks. We don't know why. We don't know if that's, there's a lot of debate. We know children can get the virus. We know that they can transmit the virus. We know that in very rare cases they can get seriously ill and die from the virus. But there may be different ways in which young children are transmitting that may make it different than a school of middle schoolers, for example. So we have seen some cases here and there in daycares that I'm aware of, but what I'm getting from LDH, there's not been outbreaks because of them. So that makes us hopeful that in-person learning, particularly with younger children, will be successful. But it's a case, it's just one case study, really.
The other question I have for you is we've heard so much regarding multisystem inflammatory syndrome. Obviously troubling news that we've learned, we just had another child die from that. And that there, are you concerned as a public health official that with just Louisiana in general being a hot spot, that this could be an issue we're gonna have to deal with when school reopens?
Yeah, I'm very concerned about Louisiana being a hot spot. We are getting better, but we have a ways to go. And if you look at the latest reports that I've seen, is that over 100,000 children tested positive for COVID nationwide in the last month or two. That means that there's a significant number in Louisiana. We see that even though the multisystem inflammatory condition is rare, every new child that tests positive ups the likelihood we're going to have another kid that dies from it. And that's avoidable and tragic. Every death is tragic, but particularly if a child, dies from this. So, yeah, I that's yet another reason to get our numbers under control.
Okay, and finally, DSU.
As we know, the Archdiocese schools operate differently than the public schools. The question is, how is the communication with them, and are they willing to cooperate with you and your data if you notice an overtrend in your cases?
Yeah, I mean, we've had good communications with the Catholic schools and the private schools. I think they have all this data. I've had conversations with them. The mayor has. Many people on our team have been in regular communications. It's very cordial. I know they're communicating with the public schools. They're in a little bit of a different position because their systems span multiple parishes. That's incredibly challenging because all of those parishes are doing their own reopening for their public schools. We've communicated that we believe that consistency makes the most sense. Provided them with this, and I know that for their individual schools, they're doing everything they can to protect their children. Again, we would like for everyone to be consistent. We think that's the smartest way to move forward, but we're going to be monitoring really closely what happens.
All right, one last question, and then we gotta wrap it up.
As we saw, we relaxed the phase restrictions, and we saw that surge, that spike. Are health officials anticipating kind of an inevitable spike when schools reopen?
No, I don't know that it's inevitable because the surge that we saw was largely due to people not following guidelines, right? Not wearing masks, not social distancing, continuing to go to large gatherings, and just sort of, not doing the things that we know stop the transmission. I know that all of our schools, no matter what their reopening plan is, that's not going to be the situation, as much as they can possibly prevent it. Kids are going to be wearing masks. People are going to be physically distanced. Hygiene is going to be important. There's not going to be any gatherings. There's no fall sports, right? So they're really trying within the confines. So we're hopeful that will not cause a spike. Might it cause more cases? Yes.
Last question, WWL.
There was a lot of information presented today, a lot of numbers. No, it's great. It's wonderful. Just to give a summary, how do you feel about where New Orleans stands today in all of this?
I'm cautiously optimistic today because we are seeing improvement in all the trends, as you've seen. The challenge is sustainability. This is really hard. It is hard for all of us individually for multiple reasons, many more than others. And the amount of stress and strain, whether it's health, financial, educational, psychological, is palpable. We do encourage our residents to please reach out, get help where necessary, but sort of knowing that we're going to have to sustain where we are now for some period of time, we just want to support everybody through that. So if we can all have that same shared mindset, I think we'll be able to get through it better.
All right.
Thank you all.
Thank you all very much.